Let's begin by meeting Helen. Helen is a 64-year-old female who underwent a hip replacement secondary to a fall at home. She recently transferred to a transitional care unit for rehabilitation. Aside from her anticipated physical and post-surgical recovery symptoms, she is presenting extreme abnormal aggression and agitation towards staff members. She compromises social dynamics when working with groups and routinely refuses to participate in rehabilitation exercises. She is divorced and lives alone. She told the staff that her family no longer speaks to her and that she was recently laid off from her job. She is distrustful and often claims, "Nobody really cares if I get better or not. I don't know why I need to be here." She is verbally abusive with staff and has limited insight into her circumstances. The rehabilitation team is having difficulty managing her behaviors and getting her to comply with treatment. We've all seen patients with these characteristics, but how do we know whether these behaviors are indicative of a personality disorder or just a patient with high levels of distress? Is Helen simply being difficult, or does she have a personality disorder? How do we distinguish the difference? Many literatures have highlighted that patients who are labeled difficult frequently are those who are non-compliant with treatment or challenge recommendations. They are very difficult to please and often threaten lawsuits. Studies have shown that difficult patients drain clinician and healthcare professionals' energy. Instead of processing the relevant clinical information, the professional's mental energy is often spent dealing with the patient's disruptive behavior, resulting in increased diagnostic errors and negatively impacting care. However, it is important to recognize that some patients' disruptive behavior may have medical causation. For example, cognitive or behavioral impairment may be related to head injury, dementia, alcohol or drug abuse, or other mental illness. Chemical imbalance or other organic disease process must also be ruled out. In many cases, the patient's own fear, insecurities, or anxieties may cause them to lash out.